Okay, so you're very welcome here today, joining us mostly from Ireland, but we have a couple of overseas visitors with us too. Let me just I'm going to stop sharing for a moment there, and we could just so that we can see each other there. I've got somebody else to come in. As you know, the title of this is We Need to Talk About Ageism. So we're exploring systemic ageism on a global level. So we're just looking at how people around the world experience ageism and sorry, I'm just getting myself sorted out. And we're linking it in with the Afford To program, which some of you may be familiar with. And I'm not going to go into it because Tapiwa is going to do that. That's the first thing that we're going to do. So I'd like to welcome Tapiwa and Jemma. Jemma is actually in Australia. Tapiwa, I think are you in Tanzania? He's on mute at the moment.
I'm in Tanzania. Yes, I'm in Tanzania, in Dar es Salaam. Thank you.
Tapiwa is quite a global jet setter, and you could find him in any part of East Africa or the world for that matter with the job that he does. So he's taken time out of his busy schedule to be with us today to introduce the Afford To program to you. So without further ado, I'm going to hand you over to Tapiwa Haya, as I say, from Tanzania, and he's going to share his screen with us. This is tying in with our the ageism theme of reframing aging that Age Action have got for the for positive aging week this week. So
thank you, Annette, and thank you, colleagues, for joining in this important Zoom meeting, especially when we are discussing ageism. I will not touch a lot in terms of ageism because my colleagues that's their specialty, but just to say ageism is global, and we are also seeing it, and the Afford program, which I'm going to do a big, there's a feed, I'm not so sure where it is.
Yeah, sorry. Can I just ask people to mute themselves? I was muting a few people there. We seem to be getting a bit of feedback there. Yeah. Oh, and sorry to give Tapiwa his title. He's the regional program manager for HelpAge for social protection for HelpAge International, and as I say, he's based in Tanzania. Okay, so I think most people are muted there now. Tapiwa, I will mute myself.
Okay, thank you. Yeah, it's a privilege for me and for the Afford program, which I'm managing, to do a brief presentation on what we are doing in Africa, especially. And also, we are very appreciative of the assistance we are getting from the Irish Aid, because the Afford program, which is an acronym standing for accountability and fulfillment for older people in order to raise their dignity, is being funded by the Irish government. This is the second phase of the program, which started in 2017 and is ending in 2022. We got an extension for 1 year, which is 2022, because of the COVID and other challenges the globe faced, especially to respond to the pandemic. So the Afford is being implemented by HelpAge, but also we have got partners and presentation in 4 countries in Africa. If you are familiar with the map of Africa, this is the map of East and Southern Africa. So the Afford program is in Ethiopia, is in Tanzania, Malawi, and in Mozambique. In the 3 countries of Ethiopia, Tanzania, and Mozambique, the program is managed through HelpAge International country offices. In Malawi, we've got a partner and a network member called Manepo, who are managing the program. The Afford program focuses on 3 key areas, mainly because aging issues are little known in the continent. Very few organizations are involved in the implementation of aging issues, and government generally, they tend to group older people 60 and above. So there's little information in terms of the dynamics of older people and what issues and the challenges they are facing. So the Afford program focuses on 3 areas. One is policy influencing in terms of the designing, improvement, and adoption of inclusive and age-sensitive social protection systems and programs in the 4 countries so that older people can access their rights and entitlement. The other component is to hold governments in the region accountable to their citizens in terms of delivering quality programs, and also to be participatory and transparent. And the third component, which fits well in terms of the theme of the year and ageism, is creating communities of practice that champions and influence the needs of other people. So those are the 4 components which the program is implementing. Why are we focusing on those 4 components? If you look at the history of social pension expansion globally, like from the map, in 1997, very few countries were implementing social pensions. I'm going to define social pension in my next slide, but you can see that the red, that's the Northern America and part of Latin America. Especially in Latin America, very few countries were implementing social pension. In Africa, a few in Southern Africa, we are talking of South Africa, Namibia, Swaziland, Europe, a number of countries, but Eastern Europe, very few. But in 2017, you can see the change, but the gap still exists in Africa and in Asia. So social pension, we are talking of tax-financed, non-contributory systems. That is where people mainly working in informal sector or have never been employed can get a pension. So this is non-contributory, but it's also regular, so that older people can get cash on a regular basis, mainly monthly basis. So the eligibility for social pension is your age. If you reach a retirement age, whether you have contributed or not contributed during your working life, you are entitled to get a social pension. And this comes from the UN declarations, like the ILO convention or a recommendation of 2012, that is recommendation 202, and other international instruments. Because of our engagement under Afford in the region, in the Africa region, we have engaged in terms of providing evidence on the need of older people. We have engaged in terms of providing research and evidence in terms of designing of social pension. So we have seen that a number of countries have managed to move forward and introduce or discuss the need to have universal social pension. For example, in 2016, Zanzibar, they've rolled out universal social pensions for those aged 70 and above. In Mozambique last year, they've crafted a strategy which they called basic social protection needs, which has moved from means testing, poverty testing, to age-sensitive and categorical approach. Here we are saying governments should have a system which caters for all ages, children, those in maternity, those in working age, and those who have retired. So that strategy has managed to move to that life course approach. In Uganda, the government also, they've announced a senior citizen grant in 2019. And in Malawi, they are discussing in parliament also, and also in government, the need to have a social pension. Our program has done a number of researches in terms of what is the impact of having a social protection system, especially in Africa, where there's the high level of informality, where most people are working in agriculture sector and they are not formally employed. And as a result, they cannot contribute to a pension during their working life. We have found that the introduction of a social pension, especially to older persons, it enables older persons to meet their basic needs and also to reduce poverty. We also have found that through the introduction of social pension systems, there's self-esteem and dignity of older people, because having a regular income gives dignity. They cannot beg, and also they've got that freedom to choose what they want to use that income for. And also, as the HelpAge, we work on older persons association. These are structures where older people are giving a platform to discuss. It's like globe groups in Ireland. In those structures, they are enabling older persons to have relationships, to have informal support, and to have social connections. And as a result, that improves their well-being, their dignity, and also self-esteem. So in conclusion, I just want to say this support from the Irish government is very much appreciative, and also we've found positive changes at community, at government level, because of the active discussion now in the region for the need to have a universal social protection systems for the older persons. Thank you so much for listening. I'm not so sure if there are any comments or any questions from my presentation. Otherwise, thank you.
Thank you, Tapiwa. That was great. Really good overview. And if anybody has got any questions, they can keep a note of them, and we'll do questions at the end. And I just wanted to add, I've been to Ethiopia and I've been to Malawi, and what Tapiwa was saying there is that the program that Irish Aid funds really does go a long way to giving older people there some dignity. It's not about, they don't provide the pensions, but they help people to organize themselves. So without further ado, I'm actually gonna, we'll carry on. And as I say, from Australia, and so she's working late for us. We have Jemma Stovell, who is the Global Voice Advisor for HelpAge International. And I'm very grateful to her also for agreeing to be with us today. And as I say, if you have any questions, you could put them in the chat or just make a note of them, and there'll be some time at the end for any sort of discussion that people would like to have. So it's over to you. Thank you, Jemma.
Thanks, Annette. And before I begin, I'm just going to show this short video. So I hope it works now.
So what's this all about?
Can say it again? So
I'm too old for this.
You just want me to say what people say about me.
Weird question, I guess.
My teacher says you'll grow out of it. It's just a phase.
It was never a phase. I never grew out of it.
I guess I'm too reckless, I don't know.
People like to talk very loudly to me.
They say I don't think things through.
You're looking still good for your age.
I'll figure it out when I'm older.
you are having a senior moment.
When the focus is on my age,
Life seems to get a little bit harder.
It feels like I'm not given a chance.
I need to keep up
or get out of the way.
I lack experience.
Or too much experience.
I'm baggage.
Only weighing people down.
Looking at my age
like it is a disease.
Where I work, no one takes me serious.
it makes me feel powerless.
And it hurts.
When people see only my age.
Great. Just checking that you can see that next slide.
I'm good. Yeah.
Great.
If anybody can't, and if everybody knows, you can if you've got the grid video where you can see everybody and you want to minimize that, there's usually a small box, and you can put it either, you can take everybody with hide the thumbnail, or you can just have the speaker view and we can see lovely Jemma as she speaks to us. Thanks.
Great. Okay. So yes, as Annette mentioned, I used to be, up until really recently, actually based in London. But when this request came in, I thought it would be a really good opportunity to join you. So it is a little bit later here. I've got some lights on me, making it look like it's brighter than what it is. So thank you for having me. And the next one, oh, it's missing a slide. That's okay. But basically, I work at HelpAge as the Global Voice Advisor. I've been at HelpAge for a number of years. And I think for some of you might know who HelpAge is, but we're a global network that's made up of a diverse group of like-minded organizations. So there's 158 organizations who are a part of the global network. And through our programs and that of our network members, we really support older people to live safe, dignified and healthy lives, like Tapawel was talking about in terms of the Aboard program. And our focus is really on older people in low and middle income countries. So we're really appreciative of having organizations that we work with, like Age Action Ireland, who are a part of the network and that we work with really closely. So the video that I've just shown was made by the World Health Organization as a part of the global campaign to combat ageism. And I think it fits in really well with the theme of Positive Aging Week. And it's really clear that negative perceptions about aging impacts the way that we think about our own aging and that of others around us. And if we are to challenge ageism, then we really need to think about reframing. So I think talking about positive aging is extremely important, especially when it comes to changing people's attitudes towards aging. So this is a really terrific initiative, and thanks Annette for organising it. So in terms of a definition, the World Health and I think ageism is something that has started to be talked about a lot more especially over the past few years. When I started working on it about 4 or 5 years ago, it was still a term that in many sort of contexts, even though some of our partners had obviously been working with organisation with older people for a number of years, but ageism hasn't been something that everyone has sort of had an awareness about. So it's really something that is starting to come to the forefront. And the World Health Organization defines ageism as the stereotyping and discrimination against individuals or groups on the basis of their age. And ageism can take forms including prejudicial attitudes, discriminatory practices, or institutional policies and practices that perpetuate stereotypical beliefs. And the term was coined in 1969 by Robert Butler. And it really seems incredible to me that this was recognised and defined 50 years ago, and yet there is still so much that we need to do to be tackling it. So if we look at ageism, there are 3 different dimensions. So there's the stereotyping, how we think, there's prejudice, how we feel, and discrimination, how we act. And we are not born ageist, but it really starts at an early age and it's reinforced over time. And children as young as 4 are aware of their own cultures, age, stereotypes, and prejudices. Stereotypes are subjective ideas about how a certain group is expected to think and behave and what they're supposed to do or not do. And stereotypes do not recognize the individual differences, and they can be both positive and negative. We all carry our stereotypes with us when we get them from our families, from the media, from our peers. And I'm sure many of you come across these stereotypes on a daily basis. I know that when I started to work on ageism, I really started to pick up where I was seeing it, whether it was on marketing ads or in the media. And I think we really saw it as a part of during the pandemic as well, with the media really labeling older people as vulnerable and frail. And I think that stereotypes really do value people and limit people's potential and stop us from seeing the whole person. Ageism affects people of all ages, and ageism can take place at the individual and the interpersonal level and at the cultural and institutional level. And ageism impacts us at the individual level when we tell ourselves that we can't do something because of our age. And internal ageism is the internal prejudices that we have against our own aging process. And there is a growing body of research which really looks at the harmful effects that ageism has on the health of older people. So I'm just going to share some quotes from some of the older people that we've been working with. And then after this, I'll go into some of the findings from the UN Global Report on Ageism. So we did a qualitative research project a few years ago now, where we asked older people in Pakistan, in Serbia, in Costa Rica, and in the Gambia, what their experiences were of aging and ageism. And here's some of what they told us. So they said it means exclusion, being considered different, you no longer exist. And then another person said that it's the direct or indirect actions where someone is excluded, considered different, restricted, ignored, is treated as if they didn't exist because of their age. And the final one, age discrimination is any discriminatory act of an individual or system towards another person based on their age. Oh, it keeps on skipping some of my slides. I don't know what's going on there. My other slide was just showing different areas where older people said they experienced ageism. So they spoke about ageism being experienced in the family context, on public transport, perpetrated by the government, in educational institutions, health services, finance, entertainment settings, in legal settings, by the media, and also in employment.
If you backspace, you might be able to just go back to your slide if you hit backspace.
Yeah, it's doing something
Oh.
strange where it's skipping, but
Yeah,
that's
okay.
that's okay. That's all right. I can send the slides afterwards and people can have a look at them as well. And I think this is something quite common that we hear. I don't know whether we hear it in the, well, I think we do hear it in the West. So Vera here from Kyrgyzstan is talking about that there are cases in hospitals when we have to wait in long queues to see a doctor. And when we are seen, some doctors don't bother to listen to everything that we have to say, let alone examine us properly. And that's something that we hear a lot in some of the contexts that we work, that older people take hours to get to a hospital. They wait in the queue and then they're told that their symptoms are just a symptom of old age. And this is from Daw in Myanmar, and she's talking about ageism in employment. And she says that my friends and I tried to apply for teaching jobs in schools, but we didn't get the job. It seems like people are unlikely to hire older people before considering our abilities. And I met an activist from Kenya a few years ago, and we were doing a training, and her name was Gertrude. And I think at this time she was 65, but she'd been asked to step aside at the age of 50 so that younger teachers, she was a teacher, so that younger teachers could come along and do the teaching. And she was such an inspiring person that I thought it was such a shame for her not to continue that teaching, and that she was forced out of her job, not because of her skills, but because of her age. So these are some of the experiences that and things that older people have told us. And now I'm going, oh, can you see the white slide with the different contexts?
Yes.
Yeah, okay. I think the slides are being a bit mixed up. I don't know what's going on there. That's okay. Okay, so in terms of the global report on ageism, I don't know whether anyone saw this when it came out earlier in the year. But yeah, so in terms of the global report and where it's come from and why the World Health Organization are now focusing on ageism, there was a resolution that was passed at the UN General Assembly in 2016, and it called on member states to really coordinate a global campaign to combat ageism. So the global campaign is an initiative supported by the 194 member states of the World Health Organization, and the campaign is really integral to the UN Decade of Healthy Aging. So in terms of what the report says, the report found that ageism is everywhere, and that 1 in 2 people have moderate or high ageist attitudes towards older people. And these rates are higher in low and middle income countries. The report tells us that you're more likely to be ageist against older people if you're younger, if you're male, if you have a fear of dying, and if you're less educated.
Mm-hmm.
You are more likely to experience ageism if you're older, if you're care dependent, if you happen to live in a country where healthy life expectancy is much lower, or you're working one of the sectors such as high tech or hospitality. And for younger people, there was a lot less information, a lot less data. But in Europe, the region where there were both sets of data, younger people reported more age discrimination than other age groups. And being female means that you're more likely to be a target of ageism from younger people. So this is some of the key findings. You may ask if ageism is harmful, and it's harmful and it's costly. Ageism is associated with earlier death, with poor physical and mental health, including the onset of depression. It's associated with social isolation and loneliness, taking more risks with your health, such as eating an unhealthy diet, drinking or smoking, and poorer quality of life. But ageism doesn't only affect us just as individuals, but it devalues or limits our ability to what older and younger people can contribute in their societies. It erodes solidarity among generations and has serious economic consequences for individuals and society. And ageism is really harmful in itself, but it also exacerbates other forms of disadvantage related to sex, race, and disability. But there's an overarching message of the report that is optimistic, and it talks about how we can really combat ageism. And there are 3 strategies that work in reducing or eliminating it. So the first is policies and laws. The second is educational activities and intergenerational interventions. And policies and laws can address discrimination and equality on the basis of age and protect human rights everywhere, and people of all ages. And I think what we found in our work is that many countries don't have legislation and laws that do protect older people from being discriminated against because of their age. So this is obviously something that is incredibly important. Educational activities can enhance our empathy and dispel our misconceptions around different age groups and reduce the prejudice by providing more accurate information and counter stereotypical examples. And intergenerational interventions bring people together from different generations and can help reduce the intergroup prejudice and stereotypes. These are in fact some of the most effective interventions to reduce ageism. And the report says that all of these help with reducing ageism against older people, and is also showing promise at reducing ageism towards younger people. And where possible, the report advocates that these 3 interventions are used together to maximize impact. So I've gone through some of these, but people can read through these later. And the report has three recommendations that we can use and we must use to end ageism. We need to implement and scale up the evidence-based strategies. And I think from our point of view as HelpAge, we really want to make sure that there's more evidence from low and middle income countries, because this is definitely a gap. And we need to change the narrative. So to create more positive and accurate narratives about aging, which is why I think the Positive Aging Week is such a great initiative. So I recommend that if you're interested in reading the report or finding more resources, there's lots on the WHO website now. And they're also running an initiative from the 1st of October, tomorrow, until I think it's Youth Day in November. And they'll be sharing through their different channels, the different sort of ageism tools that have been developed by different organizations. So they'll be really trying to promote the work of others in the field of ageism as well. So in terms of what HelpAge has been doing, some of what we've been doing, we've been developing training materials, we've been training staff, we've been training our network members on what ageism is and how we can think about it in our work. We've been supporting our partners in a number of countries to be campaigning ageism, and these campaigns each look different in the different contexts because they may focus on a different manifestation of ageism. And then we have been raising awareness about ageism through our different social media channels and creating different sort of comms content. Last year for the International Day of Older Persons, we created these animations which tried to get people to think differently about what they were seeing and changing their perceptions. So you can, if you go to the link actually that's up on the slide, then you can see some of those old animations. We want to continue building partnership with other organizations. So we continue to work with the WHO. We also want to work with more academics to make sure that they continue doing research in this field. And we're looking at how we can join more with other sort of youth organizations in some of the countries that we work in, because we know that intergenerational activities do help in reducing ageism. So that's that. And then something that is exciting, or that we've been really excited about over the past, I guess the past year, but something that we were thinking about at HelpAge was the fact that we kept on seeing manifestations of ageism. So whether it was ageism in the media, whether I think we were seeing, politicians in Kenya, I think at one point were telling younger politicians were telling older politicians that they should go home and they should step down. And we kept on seeing these visible things that were going on. And we started to think, well, how does ageism operate as a part of a system? Because these aren't just isolated incidents, but there's something going on beneath the surface that continues to perpetuate ageism. And there's been a lot that's been spoken about systemic racism over the past couple of years, but there hasn't been a lot that's been spoken about in terms of systemic ageism. So this is something that we've been thinking about, and we've developed an animation that I'm going to share with you now. It's a bit longer, it's about 3 minutes. So I will share this with you, and it's really to help get people to start thinking about how ageism operates as a part of a system, and that once we notice it, we start to see it everywhere, and really thinking about, what we need to do to think about the root causes. So I will play this for you now. Oh no, I might just have to get the link.
I'm not sure if there's anything I can do there for you.
No, that's okay. Sorry, I might just ask you to just be patient for one moment. No, I don't know why it's not on that slide. Sorry, I'll just be 1 second.
I find it really interesting when you're talking about it. Even from my point of view, I think of ageism as, only happening to older people, but it's the whole of the lifetime. It goes from start to finish. And it's usually against people that are different. Again, that aren't the age that you are.
Exactly. Can you see that now, Annette?
Yes.
Okay. Oh, no.
One of the great challenges in this world is knowing enough about a subject to think you're right, but not enough about the subject.
Don't you hate YouTube ads? Okay, here we go.
Hujambo Mama Wanjiru.
Si jambo Mama Atieno.
Tell me, how was your doctor's appointment?
It was fine, but the doctor spent most of the time talking to my daughter about me, as if I wasn't there. I think he assumed people my age can't take in information or make decisions.
I know what you mean. At work the other day, I made a suggestion. Someone told me I was out of touch. It made me feel as if my ideas are less valuable because of my age.
I've noticed this attitude for years, but it feels like it is getting worse as I get older. You just look.
Isn't it ageism?
Yes, I've been reading a lot about ageism lately. It's about our systems in society and how ageism is deeply rooted in them. It's called systemic ageism. I like to think about a lily growing in a pond to understand how it works. Imagine that the flowers are the ageism we experience every day. They are connected to the stems in the water, which represent our ageist thoughts and feelings. And the flowers on the stems feed from the roots, which represent our beliefs and values.
So, the flower is the part we see in society, things that influence our thinking without even knowing, like when the media makes out that everyone becomes unproductive and vulnerable as we age.
Exactly, but it goes much deeper. Our experiences are shaped by what happens below the surface. Take stereotyping, for example. The idea that everyone will become frail and weak as we age makes people afraid of getting older. Then underneath all of that, in the soil, are the values and beliefs we hold, such as the belief that we are less important when we are older. These inform our thoughts and feelings, which results in the visible ageism we see every day. But I found a story that shows how fighting against this can make a difference. Look, the Philippines government brought in ageist lockdown measures to try and control the spread of COVID-19. Older people were not allowed out, and many said they were denied access to health services. Some stores even had signs saying, "No older people." That's awful. Yes, the Coalition of Services of the Elderly launched a campaign to stop these discriminatory measures. They talked to the government and the public to understand the ageist beliefs that led to these measures, and they organized activities to challenge these beliefs and inform politicians, older people, and their communities about ageism. In the end, the government revised guidelines that older people cannot be discriminated against.
That's what we need more of, to name and challenge ageism and then explore where it comes from.
Exactly. Why don't you come and join us, huh? You can be part of the change.
Thanks, Annette.
That was great. Thank you very much. Now, can you stay with us for a few minutes? You're not dying to get to your bed just yet. That would even be a bit early for you, I'd say. Okay, so let me put my camera back on here, if I can. As we were saying at the beginning of this, Age Action are involved with through Irish Aid and in partnership with HelpAge International in the programme. So we just bookend in the ageism piece to do with the Afford 2 programme. So there may be a little bit of repetition with regards, but I have a few stories from people, which I find is what we're working on that. And this is just a few of the examples that we have. And as I say, we'll be working on this further. Let me just, I have to share my screen now. Hang on. Now, can everybody see that?
Yes.
You can, lovely, thank you. So as I say, we've got a part of Age Action, which is Ageing and Overseas Development, works on the Afford 2 programme. And I've been working on it for a few years, and it's one that I really enjoy. So Afford stands for the accountability and fulfilment of older persons to raise their dignity, and it's got the acronym Afford 2, and it's 2 because it's the second phase of it. So as Tapiwa was explaining, the last decade there's been a huge increase on the number of countries working to expand their social protection, which is basically their pension systems. So there are schemes to provide income security for older people, and that's where the pensions come in. So HelpAge and its local and international network members, they're implementing the 6-year programme, and it's been extended to 2022 because of the COVID pandemic. And there's a total of, as you can see there, just under 4.5 million funded by Irish Aid. Through their overseas, their ODP, their Overseas Development Programme, and countries covered are Ethiopia, Malawi, Mozambique and Tanzania. And the reason that the partnership is with HelpAge is because there isn't an overseas NGO, there isn't a charity in Ireland that specifically works with older people overseas. We've got the big, Concern and Goal and Trocra, but they work with all age groups. So Irish Aid were looking specifically for an organisation that focused on older people, that had the expertise and the network throughout the countries to be able to do that. So it works to raise awareness in Ireland of the issues facing older people in developing countries. So we talk about the income insecurity, getting pensions, healthcare, age discrimination, and the inclusion of older people in policies. So we want to increase public understanding of global ageing issues, and then raise the profile and the awareness of Irish aid and the overseas development that they provide to look at these things. So we work to build public solidarity with older people in overseas, and to give them a voice to share their own stories. And in particular, we work by building on our own track record of public engagement and advocacy through engaging in campaigns, outreach, and different ways of reaching people. So our partners in Africa work to promote and protect the rights of older people by helping them to claim their rights and challenge discrimination and overcome the poverty, so that they can lead dignified, secure and active, healthy lives, which is actually our mission statement and the values that we have here in Ireland through Age Action for the Irish population and Irish older people. And one of the reasons we do the public engagement is because it's everybody's money that is being spent on these programs. So we want people to see that they're actually helping people, and that it's value for money, and that the aims are aligned with the with older people and with the population here. So we've got various ways. This is our old logo. We'll have to get that sorted out, but as you can see, we've rebranded. But we would normally go out on the road and we would attend various outdoor activities, the over 50s road shows. Anytime there are any sort of community events, we take our pop-up stands and we go and we talk to people about the work of HelpAge and the support through Irish Aid. So at the moment, we're doing that through webinars. And as I say, we've got a photo and story program that is being put together at the moment, that we're going to be launching very soon. We use social media, and if anybody has any other ideas or would be interested in us speaking to groups that they're familiar with about this program, we would be happy to do that. So I went through some of the issues for older people in developing countries, the income and pensions, age-appropriate health services, age discrimination and lack of consideration, and inclusion of older people in policies, and ageism, which we've heard we've had a great presentation there from Jemma. But I'm saying here that these are issues for older people in developing countries, but in actual fact, we did a survey for the budget, which is coming up very soon here, and these were quite often basically the issues that we have here in Ireland. So while figures can be quite different, and the amount that people might be getting for some sort of social protection, and the extent that they want their rights, because these are all human rights really, they're no different to the people of Ireland. So people, as I say, they want to be included, they want to have dignity, and they want to be afforded their human rights that they're entitled to. So just quickly, Tapiwa explained that they set up older citizens monitoring groups. So this is what the funding goes towards. It helps people to come together to discuss the issues that they have and to progress them. So in Ethiopia, they work with a group called IBNA, and they support groups to come together. They train them, and they help them to have a voice. So I'm just going to do this very quickly. This is Messerat, oops, I went too far there. I can't see his name, his surname there. And he is in Ethiopia. He lives in Adama, which is somewhere I actually visited. And he makes an income. His family, he's a father of 7 and all his children are employed. And he worked himself and he currently makes an income with a small kiosk. And he's the deputy chairman. He gives back. He worked in administration and he gives back to his community by being the deputy chairman of the Older People's Association in Adama. And 10 years ago, there were 40 people. And now it's this, with the help of HelpAge, they've now got 500. So they monitor, they support, and they link people in. This is where we need evidence. They provide evidence of how many older people are subsisting on very small amounts or are really struggling, and they provide that information which can work its way up to go and influence policy. During COVID-19, they supported people and they get their support from HelpAge. So the advice that they provide and the supports that they give help to keep these older people's associations going. And just one instance, there was somebody who, there could be somebody who could get some work and has a bicycle that needs fixing, but can't get their bicycle fixed, doesn't have the means to do that. And this organisation would help them to get their bicycle fixed so that they can travel to attend employment. Or somebody who would have had a job and their eyesight is going, they might help them to get a pair of spectacles that they can continue working, or they can still contribute and be part of society. In Malawi, we work with Manepo, and I was lucky enough to go there, and it's an umbrella group. And again, they set up the groups and they help them organize themselves to challenge their rights and overcome poverty so that they can lead dignified, secure, active and healthy lives. And in Malawi, this is Catherine, she's 73, she's got 8 grandchildren, because a lot of grandparents might have lost their children to HIV/AIDS, and there are a lot of older people who are looking after orphans. So she has 8 grandchildren, and she joined her Older Persons Association, and she also gets a social cash transfer. That's not provided by this program, but she managed to access it via this program. And she managed to get food for herself, but then she bought 2 ducks, and she said now she's got 5. I see 6 in the picture, so maybe that number's gone up. And then she's managed to build a house, and there was some money that helped her to pay people to get her garden together. So for her, she enjoys being part of the association because it's helping her economically very to maintain the family that she's looking after. Mozambique was the 4th country. This is just a little bit, the HelpAge program was very involved at the beginning of COVID-19. They worked very hard on behalf of older people who were quite often, as it was said, they were told to stay at home. And they were, people didn't want them to be out. They felt that, it was too high risk and they were isolated. But HelpAge International did a lot of education, and they collected evidence which can be used in the future. And they were very instrumental in providing PPE and training health authorities. So they did a great job there in Mozambique. And this is Purifacio. I don't know if I'm saying that right. She's 67. She's a widow and the mother of 3 small children. And she gets a social subsidy, as I say, not through this program, but she got the subsidy through joining the community committee, and she gets $7 a month. But she's grateful for it, and through that, she, and as I say, she joined the committee and they helped her with the application. And she managed to start raising pigs. So now she has pigs, she has some sort of income, and she's looking forward to improving her own house. And in Tanzania, very similar story. They work, and as Tapiwa was saying, in Zanzibar, they've got a universal social pension being paid out, and there are there's lots of work being done there, and it's similar. The organizations help people to get organized. They do the monitoring and they collect the information, which can be used as evidence to show how much support. And when an older person is given some sort of pension, they're less likely to waste it. They're more likely to invest it and to help others with it. So any sort of investment by the governments of these countries is an investment in community and family, because it's more likely to filter down. Children will have better nutrition. They'll be able to have uniforms, and they're more likely to go to school, and then in turn they will be able to support the older people themselves. So there's a real filter down effect. So this is Kitega Musa Salima, and he's a retired chef, and he's got 4 children and 3 grandchildren in his household. And he created a group. He's part of a group, and they buy together. They're like a cooperative. So they buy stocks of soap and other things to sell, and then they lend each other money. So there's 15 older people who have got businesses that are successful. And yeah, hold on, I can't see that there. Oops, sorry. So and this is through the Afford To project. They train and they mentor people to be able to provide more for their families and communities. So thank you very much. If you would like to, let me just see, are there questions here? No. Eileen, great, hold on.
I'm going to have to pop off, Annette.
Okay, fine.
But if anyone has any questions, just send me an email and I can respond.
There's just one there. Does HelpAge International have a self-administered questionnaire that individuals can access for the purpose of determining their own individual ageist attitudes?
We don't actually, but I have put a link in the chat box, and I know that the WHO used to have one on their website, and I couldn't find it when I just looked then. But Every Age Counts is a organization, or it's a campaign run in Australia, and I've put their link to their quiz in the chat box. So yes, take a look at that. And then there are other surveys that have been developed by academics that are a bit longer, but I think if you just want to do the sort of fun one to get people thinking, then there's a link to one there.
Yeah, and if you do find that other one and you send it on to me, or I'll take a look for it, and yeah, maybe we'll develop one.
Great.
Okay,
thanks,
listen,
everyone.
I'd just like to say thank you so much, Jemma. Let me now. Okay, thanks, Jemma. I've just put these up. This is a bit of a toolkit. It's available on our ageaction.ie website. So it's just saying ageism is everywhere. It's basically the type of things that that Jemma was talking to us about. So that's there. And what I'll do as well, I'll just put that I've just put that link on the website there. So let me stop sharing. And if people want to unmute themselves, put their cameras on. Has anybody got any questions? We've still got Tapiwa with us. Tapiwa, I noticed there that there was the lady who said she's getting $7 US per month in a social protection payment. Is that the norm? What would be the normal, in your experience, the normal amount that people might expect?
Yeah, that's the norm in the region, except in Kenya, where they are receiving something like $20 per month. But yeah, it might look a bit smaller, but it's a lot, especially for someone who have never received cash in his or her life. And also the fact that that cash is going to be received every month. So in terms of consistency and that assuring that I'm going to receive something, although they'll augment something like they'll be growing some vegetables, some crops. So that amount might look small, but it has impacted a lot in terms of their life. And for HelpAge International, we are saying, yes, as a government, start with that small amount, but over the years, we are now advocating for the government to increase the value. Like the beginning of this year with the government of Zanzibar, when we had our annual review meeting in Zanzibar, and the president came to officially open our meeting. During that, we also invited some older persons who also had an opportunity to talk with the government. And the government saying, yes, we know the value is not much, but we are promising to increase the value, and they have increased it by 20%.
Really? Yeah. That's great. Has anybody else got any questions? Or would they like to make any comments today? Eleanor.
Hi, yeah, Annette. Yeah, thanks to you and thanks to Jemma for the presentations. I suppose just thinking about ageism, the language, I think, is something that we can experience on an everyday basis. You know, you go in, you have a cup of coffee somewhere, now that we're able to do that again, and there you go, my dear. You know, it seems to come in quite quickly, and even though it sounds sort of kind, and yeah, I find it really annoys me, and I have to find a way of dealing with it. Or another thing, just over the last few months, I had some kind of issues with back pain and that. And I just felt the first time I'd ever really had those sort of issues and trying to figure out.
Oh dear, Eleanor, I think you're frozen.
Shoulder.
Oh no.
And you know, as time moved on, discovered. Pardon?
You just froze there for a moment. You were saying that you were getting over the fact being called my dear, you know?
Oh, right. Well, I have to find a way of dealing with it nicely. Yeah, I was just saying also, just from a health point of view, I had some back issues recently, and I seem to be getting a response quite quickly. Oh, it's wear and tear. And, you know, whereas I kind of felt, you know, there's a little bit of reluctance here to look at what's going on, and I think that was reflected in some of the comments earlier as well. So yeah, thank you all for the contributions.
Absolutely. There was one thing that she was saying there, that younger people reported ageism. Like, you know, they said that it was more reported. I'm just wondering if it was more reported or if it's more prevalent, you know, because as I say, I kind of was thinking more of ageism as being discriminatory against older people. That was where my head was coming from. But, you know, that's something that kind of needs to be evidence there. So, okay, is there anybody else that has a burning question for us?
No, just to say thank you very much for organising this, Annette, and thank you to Piwa and also to Jemma. Yeah, well, thank you, Eileen. I see there's a few
you know, it's worldwide, and it's so the response to it needs to be on a global scale as well. So, you know, the WHO, it's something that's the way, you know, you wouldn't accept racism or sexism the same way that we just accept ageism.
Right.
You know?
I put a little comment in the chat function, which is a link to Age and Opportunities, and it's on Mind Your Language, and they're trying to circulate that to all the media. And it's a little PDF. Eleanor, it might be useful to carry that around you, and with some of the posters.
Yeah, I see it there. Yeah. Can everybody, are you able to access that, Eleanor?
Yeah, I think I clicked on it already. I'll have a read afterwards.
Okay, yeah, I'm doing it now so that it'll come up there. Okay, well then that just leaves us to say thank you very much for joining us. And yeah, stand up to ageism. I think that's the thing that we need to do. And even just, you know, raising awareness. People don't always realize that they're you know, that they're being ageist, that their attitudes are ageist. So we need to, you know, call it out sometimes. Don't be afraid to. And, you know, only that way will the awareness of it be raised, and, you know, we start to tackle it. I just see we've had two people joining us, Eileen and Maureen, Eileen Weatherall and Maureen. Unfortunately, we're just coming to the end of this this presentation, so you might have got the time wrong. It started at 10:30 and it finishes at 11:30, but I have recorded it and I'm going to put it onto the Age Action YouTube channel. So all you need to type in is Age Action YouTube. It might not be up for a couple of hours because sometimes it takes me a while to convert it.
Thank you.
And you'll be able to watch it back, okay?
Yeah, I was on a U3A Zoom.
No worries. Listen, thanks for joining us. And as I say, we've had a great discussion, and we're just about to say farewell now. So, but do take the time and look back. So that's Eileen.
Thank you so much. Thank you. Goodbye.
Tapiwa,
thank you.
Thank you. Goodbye.
And
thank you.
Thanks and goodbye.
Thank you.
Bye-bye now.
Bye-bye.